For me, the word personality is a curious thing. We have in psychiatry personality disorders, and sometimes the psychologists will do lots of therapy with personality disorder people. I view it as three parts. One is something happens out there in the world, you see it, you internalize it, you see it, hear it, think about it, and then you think about it, you analyze it, you come up with some decisions, and then the third part is you react. You do a speech, you do a behavior, you do a thing in the world, you react somehow. So those are the three parts of the personality. Is the habitual style in which you see things out there, the style in which you assess them, that's the attitude mindset part, where you assess them, and then the adaptive or maladaptive behavior is what you do on the outside. And that style, that habit, that routine, if you will, is what I think of as a simple, easy way to look at what is a personality.
I wanted to ask you something. Like, you always say mom and dad taking care of their kid with schizophrenia. What about other cases? Have you ever experienced in your career other cases where maybe it's not the mother or the father, but maybe it's the wife, or maybe it's the husband taking care?
Yes, and in the verbalizations, like in some of those audio podcasts, I kind of go through a couple of different scenarios. Yeah, so that's the prototype model, mom and dad and kid. But it could be the other way around. And one of my close friends, I've known him about 15 years, he had an uncle who lived at home. So we have mom and dad and dad's brother, the uncle. Uncle had schizophrenia. So he's now a kid growing up with this uncle on a farm in the Midwest, and uncle has schizophrenia. So everyone around him was trying to take care of uncle. And so the adult child could be like that. Todd Logan, in that first audio podcast, the complex one about my author friend T. Collins Logan, he called himself in writing. Todd is his nickname. He had a parent with bipolar disorder. And one of my psychiatry colleagues that I met as a medical student, he was a resident, and then later Dr. Mark Rappaport became president of the Guild, this American Psychiatric Association. He had a parent that had bipolar disorder, and so he, in a sense, growing up as a kid, had to deal with psychosis as the kid with the parent that has and bipolar has psychosis with it, but it's mostly mood disorder stuff with a bit of psychosis, as opposed to schizophrenia, which is mostly psychotic stuff that can have some mood things on the other side. So they're kind of a combo platter condition, the bipolar with psychosis and schizoaffective disorder.